Hi, my name is Shin Nakamura. I'm assistant professor in Department of Periodontal Science. Our department focuses on clinical practice, research, and education in oral infections like periodontal and endodontic diseases. Today, I'd like to introduce our department. Let's get started.
I'm Toshiki Matsumoto, a graduate student in this laboratory. Periodontal disease damages supporting tissue, leading to tooth loss. My research focuses on developing a new drug for periodontal regeneration therapy to address the severe and expensive bone resorption, which has remained challenging to treat. Using cells and animal models, I aim to enhance periodontal regeneration and improve treatment outcomes.
Hi, I'm Kazuhiro Omori, an associate professor in this department. Oral infections, including periodontal disease and endodontic disorders, not only affect oral health but also have a significant impact on overall well-being. Based on our clinical experience, treating periodontal disease has led to improvements in conditions such as diabetes and infertility. Building on these findings, we have conducted research demonstrating a strong connection between periodontal disease and systemic conditions like diabetes and infertility. Additionally, we are investigating specific target molecules that could enable us to address systemic disease through oral health investigations. Our approach integrated clinical questions into research and applied research findings to clinical practice. Furthermore, by bridging clinical practice and research, we are fostering the development of the next generation of healthcare professionals. Our mission is to safeguard overall health through oral health, collaborating across disciplines such as medicine and engineering, as well as engaging in international partnerships. Through these efforts, we aim to advance research, clinical practice, and education for the benefit of society. We look forward to meeting you in the future. Thank you.
This video will introduce you the Department of Oral Rehabilitation and Regenerative Medicine. In our department, we specialize in advanced prosthodontic treatment, oral implantology, orofacial pains, and temporomandibular joint disorders. We conduct basic and clinical research based on questions that arise from clinical practice. First, we will give you a brief overview of our clinical practice. This is the room of implant operations. Here, we perform implant surgeries and bone augmentation procedures on a daily basis. We use CAD/CAM and other digital technologies for the fabrication of prosthetic implants. Until now, impressions have been taken using silicone-based impression materials, but now we are using intraoral scanner to capture digital impressions and occlusal relationships. The model is then scanned using a desktop scanner and converted into a digital image. Then, crowns and bridges are designed on the computer and finally fabricated using a 3D printer or a milling machine. In our temporomandibular joint disorder outpatient clinic, we diagnose and treat patients with TMJ problems and orofacial pains. To address various questions that arise in our daily clinical practice, we are doing clinical research on oral implants, TMJ disorders, and prosthodontic treatments. And we also do basic research related to the development of BMP2-based artificial bones and methods to evaluate clenching and bruxism. More specifically, we have done various basic research on bone regeneration using BMP2, a bone morphogenetic protein, and based on the results, From 2021 to 2023, we conducted clinical trials of jaw bone regeneration using BMP2-containing beta-TCP and obtained good results. This is our cell culture room for basic research. Here we do experiments using cells collected from teeth, bones, and oral mucosa, aiming at regenerating these tissues. We analyze cells and tissue sections using various microscopes. To enhance the efficiency of basic research, we now use robots to automate sample preparation for experiments such as in single-cell RNA sequence and spatial transcriptomics. This is an example of a spatial transcriptomic analysis of mouse teeth. As shown here, RNA expression can be comprehensively analyzed with spatial information, allowing us to search for novel genes involved in the development and regeneration of teeth, bones, and oral mucosa. Altogether, our department is engaged in various basic, translational, and clinical research to address questions arising from clinical practice. We invite you to join us in embracing new scientific challenges.
At the Department of Occlusal and Functional Rehabilitation, we study and practice prosthodontic dentistry from many different angles. Our goal is not just to restore chewing and speaking functions, but also to support overall health and improve quality of life, especially for elder people.
My name is Okayama and I'm from Yangon, Myanmar. I completed my PhD last year and I'm now continuing my research as a fellow. My research focuses on stem cells and immune cells, which play an important role in bone regeneration and disease treatment. The university provides top-level research facilities and the professors and staff are very supportive, making it an excellent place for researchers.
My name is Ayaka Murashima. I am a graduate student. I am collecting data using electromyography, a throat microphone, and a depth camera. I am combining these with motion capture to develop an algorithm for recognizing eating motions.
We focus on research to prevent the problems like age-related bone and muscle loss and frailty. Based on this research, we hope to help people stay healthy and live long lives.
Orthodontic treatment helps fix crooked teeth and misaligned jaws to improve how your mouth works and looks. It usually involves using braces and various devices to slowly move tooth into the right position. The process begins with the checkup by an orthodontist who makes a custom plan for the patient. In the end, orthodontic care not only improves your smile, but also helps keep your mouth healthy.
Hello everyone, welcome to Okayama University. I'm Janvier Habumugisha from Rwanda, a PhD student in the Department of Orthodontics. My research focuses on airway, sleep medicine, and cranial base. In our department, there are several international students working in different projects, different topics, including clinical and basic research. We are happy to have support from our supervisor and colleague. Please visit our website to see more information about our project. Thank you so much. Welcome to our university.
We have many international students in my department. Let's study with us.
Welcome to the Department of Oral and Maxillofacial Reconstruction Surgery at Okayama University Hospital. Our team specializes in surgical treatments for cleft lip and palate, jaw deformities, and oral tumors. For complex reconstructions for oral cancer, we collaborate closely with ENT and plastic surgery specialists. Today, I'd like to introduce our main field, cleft lip and palate treatment. Cleft lip and palate are congenital conditions that affect feeding, speech, and facial growth. We take a multidisciplinary approach combining surgery, orthodontics, and speech therapy to achieve the best functional and aesthetic outcomes. Treatment begins right after birth with feeding guidance and the use of hot sprays. Lip repair is performed between 3 to 6 months of age, followed by palate repair around 1 to 2 years of age. Long-term care includes orthodontic treatment, bone grafting, and additional surgeries, when necessary to ensure optimal function and appearance. I'm currently a first-year graduate student focusing on clinical practice. In the outpatient clinic, I perform wisdom tooth extractions, biopsies, and system creations, diagnosing and treating a variety of oral surgical conditions. In my third year, I will shift my focus to research, exploring clinical or basic science studies based on my interest. Our department is committed to both clinical excellence and research. We continuously refine surgical techniques and develop new treatment methods. We welcome students and healthcare professionals from around the world to join us, learn together, and contribute to the advancement of oral and maxillofacial surgery.
Department of Oral and Maxillofacial Surgery offers a surgical treatment for the disease that affect the mouth, jaw, and the face. Our team of board-certified oral and maxillofacial surgeons possesses a specialized expertise in surgery for oral cancer, oral tumor, jaw deformity, temporomandibular joint disease, and maxillofacial trauma. We provide diagnosis and treatment for oral cancer. We produce a treatment policy with the aim of improving treatment outcomes through multidisciplinary treatment. As an advanced treatment, we reconstruct the jawbone with custom-made titanium mesh tray and autogenous iliac cancerous bone. Then we reconstruct the occlusion using the dental implants. One of our specialties is orthodontic surgery, which involves the surgical correction of misaligned jaw in collaboration with the orthodontist. For patients with severe jaw deformities and congenital maxillofacial anomalies, we perform destruction osteogenesis, a technique that gradually extends the jaw.
The Department of Oral and Maxillofacial Radiology offers imaging exams and diagnosis conducted by highly trained radiologists, supported by radiology technicians. Our department provides a full suite of exams, including plain dental x-rays, cone beam CT, CT scan, MRI, and ultrasound for all diseases in the oral and maxillofacial area. For plain dental x-ray examination, we perform intra- and extraoral radiology, such as periapical x-ray and panoramic x-ray. We also conduct cephalography for orthodontic treatments. For advanced diagnosis, we use cone beam CT, CT scan, MRI, and ultrasonography for advanced diagnosis. MRI examinations are performed for the disc displacement of temporomandibular joint disorder and other diseases such as cyst, tumor, and osteomyelitis. Ultrasound is effective for the lesion in the soft tissue and is used to examine cervical lymph node in oral cancer patients and mass lesions in the soft tissue. Our university hospital has a state-of-the-art imaging devices, 5 CT machines including 1 photon counting CT, 4 MRI machines and ultrasound with elastography, and they are used for both diagnosis and research. In addition to imaging services, we also provide radiation therapy for oral cancer. We hope to see you at Okayama University.
Hi, I'm Michio Nakano, a professor of Department of Pediatric Dentistry. In this department, we aim to develop oral health by preventing and treating dental diseases for infants through adolescence.
Hi, I'm Keiko Tabata. From now, I'll show you around our clinic. Please come in. We have 2 types of dental chair in this clinic. One is a flat type used for small children, and one is a reclining type used for children above elementary school age or those in wheelchairs. We also have private rooms here. Not all children who visit our department can behave well in dental treatment. We see children with special needs, such as those with a strong dental fear, those with systemic diseases, and those with disabilities. University hospitals are also educational institutions. Graduate students and their supervisors see patients together and provide our best dental care. In our clinic, we mainly focus on the treatment and prevention of childhood dental caries and periodontal diseases, dental trauma, malalignment and malocclusion, and oral management of children with systemic diseases and disabilities. We look forward to seeing you as an ODAPA student.
I'm Hitoshi Higuchi from the Department of Dental Anesthesiology. When you think of dental anesthesia, you probably think of local anesthesia, but dental anesthesiology in Japan is slightly different from that of the other countries. In many countries, dentists are not allowed to administer general anesthesia. However, in Japan, dentists are not subject to any regulation regarding to anesthesia management for dental patients. Therefore, there are no legal issues relating to anesthesia management of dental patients, including general anesthesia and intravenous sedation by dentists. The Department of Dental Anesthesiology at Okayama University is one of the world leaders in this field with an active clinical and research programs. To create a pain-free dental care environment, we are providing general anesthesia and intravenous sedation in oral surgery and special needs dentistry, as well as intravenous sedation in general dentistry. I hope you will come to Okayama University and feel the importance and enjoyment of dental anesthesiology.